Oh man, being back, I missed it. I missed the labs. I really needed it. I'm a really hands-on person, so when everything started going online, I was like shook. I'm like, I don't like sitting. I like to do stuff. I like to touch. That's why I got into the field. To come back when they announced the boot camp, I was like really excited. I'm just like, yes, I get to touch my pipettes again. Like,
I say a lot, like I wish I graduated a year sooner, because then I would have been in the field, you know, with COVID and everything. Last semester we took an exam in one of our classes about COVID before it even was a thing. Like we were already learning about it as a disease or as a virus in the first place.
College of Health Sciences is very busy engaging our students because, as you can probably imagine, it's really critical and really important for our students to, in a sense, have hands-on experience or at least exposure to patients and working with them.
Our college especially has, athletic training, physical therapy, nursing, speech pathology. And, I think as healthcare professionals, our students learn to adapt. So this is just one more bump in the road. We just have to be flexible about it. And they've been terrific. I can't say enough about our students, our faculty and staff.
We've really learned many things from COVID-19. I think it's provided us with an opportunity to enhance learning using virtual tools. And I think it's also made it really cool to be a scientist.
To be in the field, like right now, with all this stuff going on, it was like, what? I get to tell, when they announced it, like on the news, they're like, we're doing PCR testing. I'm like, I know what that means. Like, it was just like almost like a confirmation thing. Like, I'm going down the right path. I chose the right thing. And then also like exciting, like, you get to see and watch your whole field be the headliner of everything.
It's just something that motivates me more to want to be a nurse and want to help people, especially now more than ever.
It's very important for nurses to be on campus right now, especially with the students who are going into clinical. And so they really need time to solidify some of those hands-on skills before they actually have to do them on real people.
While as much as it is a challenge that we wouldn't have wished on anyone, we are leveraging this crisis as a way to train our students in every way possible, while at the same time keeping them safe.